All right, so in this week's tip, we're talking about how to have 100% scheduling rate for your recare patients. All right, so 100% scheduling rate for your recare patients. Can it be done? Obviously not. It's everyone, I ask them, what's your attrition rate? Or when was the last time you added a hygienist? And they'll say, well, we haven't added a hygiene day in over a year. We haven't done that. Okay, good. So those two things don't make sense. How are you getting 20, 30, 40 new patients every month, but you're not adding hygiene days? Well, that means that new patients are replacing existing patients, right? It's a simple mathematical formula. So I had 100% scheduling rate for my recare patients. And any staff member who's watching this just said, because they think it's impossible. And it is impossible if you're not cheating. Okay, so if you're not cheating, you're not trying. And if you get caught, you're not trying hard enough. And that was the motto I had for scheduling. So how do you cheat when it comes to scheduling? First, a few things that need to happen. Okay, let's just talk about the setup. Where does this go wrong? How do most practices have a 40% attrition rate every year? That means patients are leaving the practice without appointments. It's almost one for one what's occurring. Maybe they're leaving the practice with an appointment that they're not showing up for, but then they're not rescheduling. Okay, but it won't be the tune of 40%. Okay, so how is that occurring? It's typically not on the hygiene side. That's not where you're going to miss most of your patients. From a setup point of view, if someone's coming in to see the hygienist, let's say we have 8 a day to see the hygienist, I would say that 7 out of 8 are automatically booked in the back. They're done. They're booked, right? So, you're talking about like an 88, 89% schedule rate. That's pretty good, almost 90% at that point. So maybe there's one guy. So how do we get to 40%? How do we lose 20 to 40% of the practice every single year? Okay. It's on the doctor side. You're going to find this out one for one, trust me. During your morning huddle, and if you're not doing a morning huddle, that's okay. All we need to do is take a look at everybody in the doctor column that doesn't have their recare appointment, and they need to be circled. And you need to give that responsibility to somebody to get them scheduled. So that was my job. That's what I did. And I made sure those patients that were circled got an appointment. Now, how they got on the doctor side without the recare appointment, that's a different problem. And we can address that later. But here we are today during morning huddle, and we have a total of 8 patients seeing the hygienist, and we have a total of 8 patients seeing the doctor. You are going to be shocked at how many of them do not have their appointments into the future. And there might be 10 or there might be 12. Okay, good. Circle them. Now someone's got to be responsible for getting them in. With the hygiene, it's pretty easy. It's not hard. Okay, so I'll tell you right now, any of the staff members that are having difficulty scheduling their recare appointments for patients that are coming in for their hygiene appointment, it's pretty simple. It's going to be the same thing we're going to do with the doctor side. This is where we're going to cheat. Okay, so patients would come to the front desk and I would say, okay, I need to get you scheduled for your recare. I don't have an appointment for you. You're due in 3 months. You're due in 4 months. You're due in 2 months. You're due in 6 months, whatever the time frame was. And these patients, well, the reason they're not scheduled for many, reasons, obviously, but sometimes they're just difficult or their schedules are hectic or they don't know it, right? You've heard them all, right? I don't know my schedule 6 months from now. I'd always be like, oh my gosh, who does? That's crazy, right? Like it's true, who does? But these days, how many of you have one of these? I think almost everybody, right? Your entire life is in here, and so is your schedule. Now, I never pressed them on it too much, so if they're telling me that and they own one of those, it means maybe they're not being as honest as they need to be, or they're unwilling to look at their phone, or maybe they really do not know their schedule 6 months from now. You guys know how the conversation goes, right? I don't really know what my schedule's going to be like right now. I need to get back to work, see where I'm going to be. I'm like, oh man, it's crazy, right? Who would know? Listen, why don't you do this? Go back to the office, check your schedule, give me a call. And they go, that sounds great. Thanks, Jeff. And then I booked their 6-month appointment. I just booked it. Why? Because I'm going to forget, they're going to forget, but guess who won't forget? The practice management software system. And they're going to get a notification at 3 months, at 2 months, at 1 month, 2 weeks before, right? The system that you're paying for is designed to do exactly what we want it to do, which is notify the patient that they have an upcoming appointment. And we can set those filters or those rules of when we do notification. But the point is, have the software system do it. That's what cheating is, okay? That's what I did for all of those patients. Unless we don't want to see them. But that's a whole nother story. You guys know who I'm talking about. The patients that we don't want to come back. But they always come back anyway without an appointment. It's one for one how it works. But most of the other patients, they get busy. Life gets in the way. And now we're running them down doing reactivation. And just so you know, doctor, and you already know this, reactivation, right, is an entirely separate job. Typically, we're understaffed in the practice. We can barely call and make confirmations or handle labs or handle incoming patients. Now I'm going to dedicate 40%, by the way, of 1,500 charts, 600 phone calls in a year. Who do you have in your practice that can make 600 phone calls this year? This week? This year, it's probably even a better question. No one. So we want to avoid reactivation, okay? The way to do that is to cheat. Okay, good. Now, you're going to get phone calls of patients that are upset about, I never made this appointment. And this is where if you get caught, you're not trying. I just blame the software system. Like one for one, I would always blame the software system. Someone would call in, they'd be like, I never made this appointment. I was like, I know. Oh my gosh, this is crazy. You're like the third phone call this week. Something happened with our software system. It did an update. It's crazy, right? Just blame software. And I'd be, well, I got you on the phone now. What works, right? That's how I had 100% schedule rate. Put somebody in charge of it, circle all the names, and just make the appointments. Trust me, it works. That's your tip for this week. If you like that tip, smash the like button, the subscribe button, hit that bell so you get notifications when we have new tips coming out. Thanks for tuning in. I'll see you next time.